The media narrative and the politicization of the pandemic have dictated public policy instead of the science dictating it, instead of the medical community being the guiding hand. I'm Dr. Alina Sholar. I'm a plastic surgeon, and this is my second opinion. Hi, I'm Dr. Alina Sholar. I'm a plastic surgeon in private practice, but I'm also the owner and CEO of a multi-location physical therapy and PM&R clinic and regenerative medicine clinic in San Antonio and Austin, Texas. People seeking care for critical things like heart attacks and strokes have been decreased by 60% or so. And because they're not going to the ER, they're just simply dying at home. We have got to allow access for these most critical things. But to be able to do that, even if we release the lockdown so they can go to the hospital, we also have to erase the fear, because if we don't do that, they simply won't go out of fear for contracting COVID-19. That's a problem, and it's a problem that's been created by the media. Now the media's got to undo it. Newsweek had published a headline back at the beginning of May that specifically about Texas, and it was something like Texas tops fatality rates as plans to reopen. And what it makes people think of is that the reopening has something to do with increased fatality rates. And it also makes someone think that, well, Texas has more fatalities than anywhere else, whereas neither one of those are true. So that's an example of one that just, it's just so egregious that it really highlights the way the media likes to put a spin on facts and turn them into non-truth. People are seeking information and they're getting it from anywhere they can find it, misinformation, disinformation or not. It so often is just pure junk. We really put out there to patients to alleviate their fears of specifically coming into our office, and then just letting them know physicians are the experts at keeping you safe, especially surgeons. We are all about sterile technique. The media narrative and the politicization of the pandemic have dictated public policy instead of the science dictating it, instead of the medical community being the guiding hand. So already today you're seeing governors of states dictating what doctors can prescribe to patients, that they're interfering with the doctor-patient relationship, and that corporate practice of medicine is illegal. However, that's what these governors are doing. And I fear that for our patients' futures, unless we return to the doctors being able to take care of their patients, that we are going to end medicine as we know it.